practices, I try to help them kind of focus on three often overlooked things in terms of nuts and bolts, bread and butter type practice management issues. One of the primary things I work with offices on is converting new patient inquiries. So taking the new patient phone call and turning that into an actual appointment. That's often a real weakness in practices. So teaching teams with verbiage to answer tricky questions on the phone about insurance participation or price questions or, overcoming any obstacles that new patients might have. And that's a real front-end kind of easy growth, low-hanging fruit type of topic for us to work on. The second thing that I think that a lot of practices have some weakness in is case presentation. And not always on the doctor side, though often they can improve their verbiage and their approach with patients. But working with so much with front desk teams, tend to see it really fall apart when it transfers from clinical team to front desk in terms of presenting fees and overcoming obstacles and helping people feel ready to proceed and moving those patients to appointments. I work a lot on verbiage and process to convert and close already presented treatment in the doctor's room to making the appointment up at the front desk. The third pillar that I think is often weak, and these three are kind of a cycle, is the patient experience or patient retention. So oftentimes I'll see practices that are really good at having new patients, and they're pretty good with their case presentation, but their practice isn't really growing. And when we dive in, we realize that there's sort of a backdoor problem and that their recare isn't very healthy, and for some reason or another, patients aren't coming back or aren't prompt in their return to the office. Tackling that's a little bit different from office to office, but diving into what's going on in that patient experience to build strong patient retention is something that I love fixing with teams. Some really common issues that I see with patient retention. One are that the practice has joined some sort of automated system and completely given up on contacting people personally. I love automated systems, and I think they're fantastic for reaching out to the people who love communicating that way, who love to schedule their appointment when they get a text. Those things are fantastic, and they do a lot of legwork for us. But I still believe that picking up the phone and calling a patient to say, hey, we haven't seen you for a while, is a powerful and valuable thing to do, and totally worth the effort to retain the patients that have already experienced us instead of focusing on getting new ones.